Yesterday, I had my electrosurgical excision procedure to cut abnormal cells off the tip of my cervix that are growing from HPV-16 again. I was so excited to come on here and tell you guys, oh my god, it went perfect. The nurses finally listened to me about how to apply an IV on an Ehlers Danlos patient instead of arguing with me, because I came armed with a doctor's note on how to do it and why you need to listen to me. Do you think those nurses argued with me for 2 straight hours and had me sobbing in the bed the entire time I was there? Ding, ding, ding. You got it right. The first nurse wouldn't listen to a word I said. She was cutting me off. She was talking over me the entire time. I said, I'm not doing anything until I speak with the doctor. They come back to me over and over and over and argue with me over. I said, I'm not doing this. My doctor finally comes, is apologizing for these nurses' behaviors. I'm so sorry, Jessica. She's holding my hand. She goes over and is explaining to these nurses why they need to listen to me. And what do these nurses do right in front of me? Oh yeah, that's what we were telling her, Jessica, right? That's what we were telling her. Because they were also telling me I couldn't take my pain medication. And I was like, listen, I'm just gonna leave. Like, I'm not doing this. And my doctor was like, yes, you can take your pain medication. And these nurses are like, oh, you have your pain meds, right? Lady, I'm not playing this game where you pretend that you weren't doing what you were doing the second the doctor shows up. So then finally another nurse comes and she's like, okay, we talked to the anesthesiologist, we're gonna place your IV. And I'm like, in the elbow area? They were like, yes. So she goes to place an IV in this main vein. She gets the needle into the skin, and then she's digging, she's digging, she's digging, she's digging, she's digging. And I'm sitting there, I'm like, okay. 30 seconds-ish goes by, and then she gets it into the vein. We're in the vein. I'm like, okay, sick, finally. And then boom, she hits a nerve. So my whole arm starts clenching up, right, and spasming. And it's involuntary. She's pressing on the nerve. She's the one that's controlling if that's happening or not every time she presses down on the needle and the catheter. So I'm like, pull it out, pull it out, pull it out. You're on the nerve, you're on the nerve. Stop, stop, stop. You're on the nerve. Pull it out, pull it out, pull it out. The other nurse comes over. She's like, are you in the vein? She's like, I'm in the vein. I don't know what she's talking about. You're on the nerve. We're not talking about the vein. We're talking about the nerve, okay? Pull it out, pull it out, pull it out. She finally pulls it out. Instantly, my arm's able to relax. And now I'm having shooting pains right down here into the middle of my hand, right? She goes and she tries this vein right here. She gets it, boom, first shot. You want to know what she fucking says to me? You wouldn't let us put needles in your elbows, and look at that, I got it the first try. You didn't want me to use your elbow, I got it the first try. I should have. For 2 hours, I begged them to use my elbows because I do not consent to them blowing every single one of the veins in my hands, wrists, and forearms. Oh, and then these nurses are gossiping about me directly in front of me so that I can hear. They're saying, oh, you hit the nerve when you went in her elbow? No wonder. That's why we don't put IVs in the elbow, because they're more likely to hit nerves. She's the one who prefers it there. I do not prefer IVs in my elbows. My veins prefer my elbows. This is not me making the decision. All of my other veins blow. This is not a choice. This is something that is forced upon me. What are you talking? They're acting like I just like it like that. I didn't choose this. I would prefer you put it in my hand. You can't put it in my hand. And I said to her, I can't believe you just said that to me, when for 2 straight hours, I'm sitting here sobbing and having to argue with all of you because you're telling me they're not allowed to put I'm not even restarting this. They're telling me they're not allowed to put things in here. And I'm saying I understand why on normal patients you're not allowed to do that. I've gone through this a million times, okay? Your concern is that my arm is gonna be bent, we're gonna get a blood clot, okay? On the surgery table, there is literally an attachment to the table strictly for my arm to be stuck in this position. It is not going to be a problem. The anesthesiologist is not going to have a problem with it. You want to know how I know? Because I've already been through this process 1, 2, 3, 4, 5 times now. 5 times now. Because what happens is you blow every single other one of my veins, and then the only option left is the elbow. Okay? So of course the anesthesiologist is like, we'll just go in the elbow. She has no veins left. So I'm telling you to start at the elbow, because that's the end. That's where we have to end up every single time. These chicks wanted to argue with me for 2 fucking hours, and then the audacity to finally get it in the vein, and for her to say to me, oh my God. And then the anesthesiologist comes over And she was like, so, like, what was going on? I was like, they were just not listening to me. Like, this is the deal. And then I had to get her to pull out the first IV she got because she was pressing on the nerve. And she's like, okay, well, like, if it's a little uncomfortable, the IV, it's okay. The procedure is going to be quick. I'm like... In 2022, I had an upper endoscopy where they gave me nerve damage in my arm that showed up on an EMG 2 years later because they refused to listen to me that the needle was pressing on the nerve. And then they gave me an endoscopy where they rolled me onto that arm and I was awake and I'm trying to scream for them to stop because the fucking nerve down my arm is shooting over and over and the meds weren't working, so I'm wide awake. That, like, you cannot have give me nerve damage for 15 minutes, okay? Because it lasted 2 years. As soon as I can feel that your needle is fucking putting pressure on a nerve and it's sending shots down my hand, it has to be taken out immediately. There's no, like, they're acting like I'm just, are acting like I'm just don't like needles. I never have a problem getting blood work, ever. I never have a problem getting an IV when they listen to me the first time. Like, you'd think they would have figured that out when she put the needle in and for 30 seconds is going like this, trying to find a vein, and I'm not flinching. I have zero reaction. You'd think at that moment that nurse would have realized, oh, she really actually doesn't have a problem with needles. And then the second that she gets it in, I don't flinch. Only once she's shoving it in the full way that I involuntarily am like this. And I can't, she's like, relax, relax. I'm like, you're on the nerve, I can't. You're on the nerve. You're pressing on the nerve. Every time she would push down on it, my arm would fucking do this even more. And she was getting mad at me. And then the fucking audacity to finally get it on this vein, first try it, and tell me you didn't want us to put it in your elbow. So, I had the procedure. They were able to make me unconscious, lit. Never had any problems there, thank fucking God. Because the anesthesiologist was like, I'm just doing exactly what they did last time. I'm like, sick. My friend stayed with me for 24 hours. I'm still on a shit ton of painkillers. And you want to know, I'm going to make another video about this, actually. Let me post this one for you guys, and I'm going to talk about more information now. Because I found out the reason why, when I was in the hospital, they weren't taking anything I was saying seriously about my liver and my other health problems contributing to this is because they only wrote down 6 diagnoses. 6 diagnoses. My discharge letter from the hospital has Ehlers Danlos, POTS, borderline personality disorder, bipolar disorder, and ADHD. That's all they chose to include. So every time I'm telling the doctors, yo, my liver is killing me, I need you to do an autoimmune panel, they're like, I don't know about all that, because nobody wrote it in the file. I handed them a full sheet of paper with all my diagnoses listed on it. And I realized that's why I'm just sitting here on a fuck ton of painkillers. That's the only reason I'm not screaming bloody murder right now, is because I am on a fuck ton of painkillers, okay? I've never been on this much drugs in my life. I'm not allowed to drive a car. And I need to move. But I have an appointment on Monday with the liver specialist. I have an appointment on Thursday with the endometriosis clinic, and I just have to tell them, this is how much milligrams of morphine I'm on a day. I need to get off of this immediately because my liver enzymes are already elevated. And they think that's just because I'm on medication. It has nothing to do with the fact that I have a literal liver disease that kills people by 40. Which, it's scar tissue inside my bile duct. It could be endometriosis. That's what people have been pointing out. But Jazz was with me all night. I was waking up in the night and she's giving me my painkillers and shit. Helping me get fed. But I just have to tell that endometriosis doctor, I need off of these drugs immediately. So whichever one of the patients on the wait list is on a lower dose of morphine or opioids than me, I Please, can I go in front of them? Like, this is an emergency. I may look perfectly fine right now, obviously not the fucking sobbing part. But when I'm on my full dose of painkillers, I look like I'm not in pain because I'm on a shit ton of drugs. I cannot be taking these medication. I need to drive a car. So please just bump me up the surgery list immediately because I need to move, bro. That's my story. I'm gayer than I look. You can't even eat